Hello, I'm back. It's my final live of the week. I'm going to be talking all things scars. I've got my little skin model here and other models with me. I've been doing it live every day this week. If you've missed some of them, do go back through and take a look. The whole point of the lives is to celebrate the fact that we've got a sale event on Understanding Scars Advanced Online Theory course, a self-paced course that you can work to really enhance your knowledge and support patients who've had surgery or injury recovery better. But even if you don't have the time to invest in that right now, why don't you take a look at these live videos? They give lots of little snippets of information really to enhance what you'd be able to think about and advise with clients who've had a recent or historic surgery or injury. So hopefully that's something that's going to be useful for you. On Monday I was talking about documentation, take notes, was all about really thinking about what do we need to capture, how would we make notes during therapy treatment, and perhaps how would your client make notes, which is going to benefit whether or not you're tracking progress through that treatment. Then on Tuesday, get moving and scar tissue and stiffness, really looking at the fact that in early healing, so in the first sort of 3 months, it may feel that everything's going beautifully, the scar's quite soft, it's fairly mobile, it all feels nice, but actually it's during that maturation phase that you get a changeover in the collagen and the scar can become stiffer, and that sort of more fibrotic nature that we're familiar with in mature scars. If we really work on keeping the tissue mobile while it's going through that maturation phase, we're going to have a better end result with more mobility and less chance of that kind of contracture happening. On Wednesday, that hot day of the week, I was talking about hydration and scar tissue. Have a drink. Now, we all advise our clients that they ought to keep their fluid intake up with lots of water. But are you advising your client to help protect the skin barrier when that's broken with application of topical products? So thinking about delivering moisture to the skin when you've got transepidermal water loss or water loss through the epidermis, that top layer of the skin. And that's one of the things that can leave lots of symptoms in your clients. So if you can go and support them with that, you can minimise those symptoms, which can be really unpleasant. Yesterday, keep it up, trying to keep the momentum going. I was talking about how actually some individuals, particularly with injuries to the lower limb, will end up with persisting swelling, edema. Inflammation is common in that early healing, but what we don't want is for it to persist, and we don't want it to impede range of movement, impede recovery, and it can just persist because you've got not very good backflow, particularly from those lower limbs, like I said. So I was looking at that. And today I'm doing Mix It Up. It's Friday, Glastonbury's officially started. And so I thought let's get going with those mixing it up vibes for Friday. And this is all about using a varied approach to scar tissue treatment. So if we first think about kind of level of the touch and how we need to vary that level of touch during a scar tissue treatment, and that's where my little skin model comes into it. So if you think about the properties of the skin and the functions of the skin, we've obviously got the hair follicles, you've got lots of superficial nerve endings within the layers of the skin, some more superficial, some slightly deeper, and then we've obviously got the hypodermis and the fascial layer underneath that. Now, if we've got a scar which has caused injury or trauma, obviously lacerating through or breaking or burning or damaging that skin layer, that's going to need a level of touch if that's the layer of tissue that you're aiming to try and get to regenerate. And often I think we're busy diving into deeper tissue, whereas actually we need to provide some stimulation to the skin. We need to think about the skin. The skin is a functional organ and we're not spending enough time thinking about it. So how thick is the skin? Well, it depends on the individual, it depends on the part of the body. The skin around the eyes is going to be much thinner than the skin through the abdominal area, or the skin on the hands where you've got much more a slightly different layer on the hands and soles and the feet, which helps with grip. So thinking about how would we stimulate this layer if we've got trauma to it, if we've got hair follicles missing, if we've got damage, if we've got lack of sensation. So here I'd advocate quite a light touch. I'd also think about, rather than kind of being compressive, rather than kind of pushing through the skin, I'm thinking about trying to kind of almost plump up the skin, hydrate the skin, and if possible, get some space between the skin and the deeper layers. So for that, I do really love that negative pressure. I love the lymph touch. I love the deep oscillation, because both of those provide some lift of the tissues. I like the little manual silicone cupping that I was also talking about this week to provide that lift, because you can see even on my skin that once you've got that suction on, you can actually really start to draw up the tissue and move that superficial layer, really kind of focusing on that. Got a haircut booked next week, I think I need it keeps coming in my eyes. So thinking about stimulating that superficial skin layer with those light touches. Let's go down a layer. Then we've got our deeper tissue. So here, a lovely example of the knee. So if you've got somebody who's had an injury perhaps to one of the tendons, or maybe they've had a bigger operation where you've got damage that goes really quite deep into the body, different thoughts about how you're mixing up your treatment is, if it was a keyhole surgery, for example, thinking about really where were they going with the instruments and perhaps what position was the knee in during treatment. So it may be that you want to get them side lying so that you can really get in and around in a different way with your pressures, thinking about that three-dimensional approach to come in around the back of the knee, particularly after knee replacement or bigger knee surgeries, making sure you're looking at that whole joint rather than just coming on with a singular approach from on top of the patella, which is going to have some limitations on how that really gets in and around to those different parts of the joint. So thinking about client positioning in abdominal surgery, I love to get the clients side lying as well. And once you've got the different gravity pull, the skin is and the superficial tissue is then falling away. You can actually get in quite deep and do some deeper techniques, which should be really helpful without having to kind of fight through the body and push too hard, which I really love. And then let's go down another layer. We've got an example of somebody who's had a hip replacement here, so lovely little prosthetic in there. And think about these hip replacement scars are often quite small and very beautiful, but if we look at the trauma that's gone in down the femur, really they put a new little socket joint for the hip to sit in and so on. There's a lot of really deep trauma after a joint replacement surgery. So how are we going to get our touch? How are we going to influence through the tissue layers in order to get to something like that? So again, thinking about whether or not we can change the level of touch, perhaps bring in some client movement. If you're getting the client to move while you're holding the tissues, you get a different kind of ringing effect through that fascial tissue down into really deep tissue, which I really love using. So thinking about bringing in some client movement can again mix up what you're doing, change it up and bring in a different dynamic, which really might help progress on through treatment. We can think about different techniques, from pumping techniques to stretching techniques to gliding techniques, and think about how those different techniques will bring different stimulus during your treatment. Then we can think about, well, what else could we bring into that treatment scenario? How could we mix it up even further? Here's where you've got things like IASTM. So I've got the scar wand here, lovely little IASTM, which I'm often prescribing for clients to have a go at home, particularly if they don't like touching their scar, and if they need to do lots of small movements. If somebody's got kind of more limited movement, so perhaps older people, or if the scar's somewhere hard to reach, the IASTM can be really good because you don't have to crane to get around to certain positions. You can reach across and move with it, or like down on the knee again. It's really nice and useful. And then think about leaving some sustained treatment going on with your clients. So perhaps something like some kinesio tape, like the rock tape. You can change the tensional dynamics through the scar, which will be different from what you provide during your clinic session, where you may have a bit of activity, but it's not the same level of activity on and around the scar site that you will get if you've got K-tape left on during the next few hours, few days, whatever's appropriate for the kind of surgery or injury that you're working with. I'd be a bit cautious using it in early healing, because you've got then at that point quite a new scar, a new skin barrier, in which case you've got to think about, you've got an adhesive, which I wouldn't put directly over a scar in those early phases, but you could consider putting some silicone underneath, which would then protect the skin, and then lay the K-tape over, which would start moving through those different layers, which can work really well. Or the other thing you can do is think of that as something, as the scar matures, to bring in those different tensional dynamics, which can be really good. So there's loads of different ways that we can think about bringing in different ways of working with people after injury and surgery. And if I've piqued your interest today and you want to think about different kind of surgeries and different injuries and the way that you could be influencing or changing that person's recovery, do consider coming over and taking a look at Understanding Scars with 50% off at the moment. It really is a highly comprehensive course that looks at many, many different examples of surgery and injury trauma at different levels of tissue, at different parts of the body, with lots of considerations that you should be thinking about if they walk into your clinic. On top of that, you've got lots of references to research, you've got bonus interviews with experts around the world. So it's something that I think could be helping you become a better practitioner to support injury and surgery recovery. And we've had many testimonials and emails about the course to say how helpful people found it was. Or if you're keen to learn some hands-on techniques, come on over and check out our blended courses with a mixture of some really basic online theory together with those all-important hands-on techniques with a varied approach through my courses. They're not on sale, they're really great value though. You really do come away with lots of different ideas of working with scars. So if you missed it, because that's my wrap up for the week, tomorrow I can lounge around in my PJs and have a lovely slow start. On Monday I was talking about take note documentation for clients after surgery and injury. On Tuesday, get moving, talking about scar tissue and stiffness, and all about how that scar gets stiffer as it matures. Wednesday, have a drink, hydration and scar tissue, thinking about that water loss that we've got occurring at the scar. Yesterday I was talking about keep it up, fluid build up after surgery and injury, and today I am done. Mix it up is done. So have an amazing weekend. Thank you so much if you've joined me live this week, and if you're watching later, hope you enjoy this. Please do share within the community to anyone that you think would benefit. Bye then.